Have you ever wondered what problems can occur with a central line and how to fix them? A central line, also known as a central venous catheter, is a tube that doctors often place in a large vein in the neck, chest, or groin to give medication or fluids. It can also be used to collect blood samples for testing. As invaluable as they are in the medical field, central lines are not without their complications. From central line-associated bloodstream infections or CLABSIS to mechanical complications and even thrombosis and embolism, there's a myriad of challenges that can arise. And with each of these problems comes a crucial need for effective solutions and stringent infection control guidelines. But don't worry, today we're going to delve into some of the most common problems and their solutions. So sit back, relax, and let's embark on this informative journey together. One of the most serious problems associated with central lines is central line-associated bloodstream infections, or CLABSIS. So what exactly are CLABSIS? These are serious infections that can occur when bacteria or other germs travel down a central line and enter the bloodstream. Central lines are used to deliver medication or other treatments directly into a large vein near the heart. However, if not properly managed, they can provide an entry point for pathogens. CLABSIS can have a significant impact on patients. They can lead to prolonged hospital stays, increased medical costs, and even severe illness or death. In fact, it's estimated that approximately 1 in 7 central line infections leads to a fatality. But the good news is, CLABSIS are largely preventable. One of the key strategies in preventing CLABSIS is ensuring proper hand hygiene. Healthcare professionals must wash their hands thoroughly and frequently, particularly before and after handling a central line. Aside from hand hygiene, aseptic technique is crucial. This involves using sterile equipment and maintaining a sterile environment when inserting and managing the central line. It's also important to regularly assess the need for the central line. If it's no longer necessary, it should be removed promptly to minimize the risk of infection. Another vital aspect of managing CLABSIS is continuous education and training for healthcare professionals. They must stay updated on the latest guidelines and best practices for central line care. Regular audits can also be helpful in monitoring compliance and identifying areas for improvement. It's also worth mentioning that patients and their families can play a role in preventing CLABSIS. They can remind healthcare professionals about hand hygiene, ask questions about the necessity of the central line, and report any signs of infection promptly. Remember, prevention is the best form of intervention when it comes to CLABSIS. So, let's roll up our sleeves and do our part in keeping our patients safe from these potentially life-threatening infections. Another common issue that can arise is mechanical complications. Diving into the mechanical realm, we find a variety of issues that are not only common but also quite challenging to handle. The first one that comes to mind is line blockage. This can be caused by a variety of factors, including blood clots, medication buildup, or even a kink in the line. The solution? Well, it's usually a two-step process. First, you need to identify the cause of the blockage. Once you've done that, the next step is to clear the blockage, which usually involves using a specialized solution to dissolve the obstruction. Moving on, we encounter another common mechanical issue: dislodgement. Now, this happens when the central line moves out of place. It could be due to patient movement or improper securing of the line. In this case, the line needs to be repositioned and secured properly. This might sound simple, but it's a delicate procedure that requires precision and care. Lastly, we have line breakage. This is a serious issue that can lead to severe complications if not addressed promptly. The line could break due to wear and tear or due to a forceful tug. If a break is identified, the line should be clamped immediately to prevent air from entering the bloodstream, and the healthcare provider should be notified right away to replace the line. These mechanical complications, while daunting, can be effectively managed with the right knowledge and technique. It's important to remember, don't panic, stay calm, and remember your training. Each of these issues has a solution, and with swift action and the right approach, they can be resolved with minimal risk to the patient. Mechanical complications are part and parcel of dealing with a central line. They are not insurmountable obstacles, but rather challenges that require a steady hand, a sharp mind, and a calm demeanor. With these tools in your arsenal, you'll be well equipped to handle any mechanical complication that comes your way. Mechanical complications can be daunting, but with the right knowledge and technique, they can be effectively managed. Thrombosis and embolism are other grave complications associated with central lines. Let's delve into these terms a bit further. Thrombosis refers to the formation of a blood clot within a blood vessel. This can disrupt the flow of blood through the circulatory system, leading to serious consequences. On the other hand, embolism is the sudden blockage of an artery, usually by a blood clot or an air bubble. When this blockage occurs in critical areas like the lungs or the brain, it can be life-threatening. But how do these complications relate to central lines? Well, central lines are placed in large veins, and any manipulation of these veins can potentially lead to the formation of blood clots. Also, during the placement or removal of a central line, air can accidentally enter the blood vessels, causing an air embolism. The consequences of these complications are severe. Thrombosis can lead to swelling, pain, and even tissue damage due to lack of oxygen. Embolism, depending on the location, can cause shortness of breath, chest pain, or even stroke-like symptoms. But don't worry, there are steps that can be taken to prevent and manage these complications. For prevention, healthcare professionals take utmost care during the insertion and removal of central lines. They use sterile techniques to minimize the risk of infection and clot formation. Also, they ensure that all air is removed from the central line before insertion to prevent air embolism. In terms of management, the first step is always recognition. Regular monitoring can help detect any signs of complications early. If a clot is suspected, anticoagulant medications can be used to dissolve it. In the case of an embolism, immediate medical attention is required. This might involve procedures to remove the blockage or medications to dissolve it. While thrombosis and embolism are serious issues, they can be prevented and managed with vigilance and appropriate care. Now that we've discussed the problems, let's focus on infection control guidelines. In the world of healthcare, we know that prevention is always better than cure. This adage rings especially true when we talk about central line complications. The cornerstone of preventing these complications lies in adhering to infection control guidelines. First and foremost is hand hygiene. It's the simplest yet most impactful step in infection prevention. Hand hygiene isn't just about washing hands, it's about doing it right. Use soap and water or an alcohol-based hand sanitizer, focusing on all surfaces of the hands and wrists. Remember, it's a must before and after every patient interaction, and before donning and doffing personal protective equipment. Next, we have the aseptic technique. This is a method designed to prevent contamination from microorganisms. It involves practices like using sterilized equipment, wearing sterile gloves, and maintaining a sterile field. For central lines, the aseptic technique is vital during insertion and dressing changes. It's important to remember that everyone in the room during these procedures should adhere to aseptic principles. Now let's talk about regular line maintenance. Central lines need care and attention to prevent complications. This includes regular assessment for signs of infection, prompt removal of unnecessary lines, and dressing changes as per guidelines. Always remember, a line that's not needed is a risk that's not needed. Another key aspect of infection control is the use of chlorhexidine for skin antisepsis. Chlorhexidine has been shown to reduce the risk of infection better than other antiseptics. It's used before line insertion and during dressing changes. Also, let's not forget about the role of antimicrobial dressings. These dressings, impregnated with agents such as chlorhexidine, can help reduce skin colonization and inhibit growth of microorganisms at the insertion site. And finally, education and training. Healthcare professionals need to be well trained in infection control practices. This not only includes the technical aspects but also understanding the why behind each action. All these steps might seem like a lot, but they are integral to patient safety. Each one of them plays a vital role in reducing the risk of central line complications. They are not standalone measures, but rather, they complement each other in a comprehensive infection control strategy. Remember, every healthcare professional has a part to play in infection control. It's a shared responsibility. From doctors and nurses to technicians and cleaning staff, everyone's actions matter. Infection control isn't just about following guidelines, it's about creating a culture of safety. It's about making every action count, no matter how small it seems. Following infection control guidelines is crucial in preventing central line complications and ensuring patient safety. We all have a role to play in this. Let's make it count. You might be wondering, what role do healthcare professionals play in all of this? Well, let's dive right into it. Healthcare professionals, you see, are the first line of defense in preventing and managing complications related to central lines. They are the ones who insert the line, monitor it, and ultimately, are the ones who deal with any complications that may arise. The first and most crucial role is that of continuous education. The medical field is ever-changing, with new research, techniques, and guidelines emerging all the time. It is essential for healthcare professionals to stay informed and up-to-date on these changes, particularly when it comes to central lines. This includes understanding the latest research on central line-associated bloodstream infections, mechanical complications, thrombosis, and embolism, as well as infection control guidelines. Vigilance is another key role. Healthcare professionals need to be observant, always on the lookout for signs of potential complications. This could be anything from a patient's change in behavior to a slight discoloration at the site of the line. It is this level of vigilance that can often mean the difference between catching a complication early and dealing with a full-blown medical crisis. Adhering to guidelines is the third important role. The guidelines set forth by medical bodies are there for a reason. They provide a roadmap for healthcare professionals to follow, ensuring that the highest standard of care is provided at all times. When it comes to central lines, this could mean following the correct procedure for insertion, using the right antiseptic, or ensuring that the line is secured properly. So you see, the role of healthcare professionals in managing central line complications is a multifaceted one. It requires continuous education to stay informed, vigilance to spot potential problems, and a commitment to adhering to guidelines. It is through these efforts that we can significantly reduce the risk of complications and improve patient outcomes. As healthcare professionals, we have a significant role to play in preventing and managing central line complications. We've covered a great deal of information today, so let's summarize. We delved into the world of central lines, a critical device in healthcare, particularly for patients requiring long-term intravenous therapies. But as we've seen, these essential tools aren't without their complications. We started by discussing central line-associated bloodstream infections, or CLABSIs, one of the most serious complications of a central line. These infections can lead to prolonged hospital stays, increased healthcare costs, and unfortunately, increased mortality. We've learned that strict adherence to aseptic technique during insertion and maintenance, and prompt removal of unnecessary catheters, are crucial to prevent CLABSIs. Next, we turned our attention to mechanical complications. These include a range of problems, from malposition of the catheter and pneumothorax during insertion, to catheter occlusion, dislodgement, and breakage during use. As we've seen, understanding the correct insertion technique and meticulous post-insertion care can help prevent these complications. We then explored the risk of thrombosis and embolism. The formation of a blood clot in or around the central line can lead to serious complications, including pulmonary embolism. We've learned that prevention strategies include the use of anticoagulants, appropriate catheter selection and placement, and careful monitoring of the patient. Our discussion then moved to infection control guidelines. We've seen that strict adherence to these guidelines is key in preventing central line complications. These guidelines include hand hygiene, use of full barrier precautions during insertion, cleaning the insertion site with an appropriate antiseptic, and daily review of line necessity. Next, we underscored the role of healthcare professionals in managing central line complications. We've seen that it's not just about the doctors or nurses involved in the insertion and maintenance of the line. It's a team effort, with everyone from the cleaning staff to the hospital administrators playing a part in preventing complications and ensuring patient safety. Throughout this journey, we've seen that knowledge is power. Understanding the potential complications of a central line, recognizing the signs, and knowing how to manage these problems if they occur is the first line of defense. But it's not just about reactive measures. Proactive prevention, through strict adherence to infection control guidelines, is equally, if not more, important. And let's not forget vigilance. Regular checks of the central line, monitoring the patient for signs of complications, and prompt management if a problem is detected, can make all the difference. It can mean the difference between a minor issue that's quickly resolved and a major complication that can have serious, even fatal consequences. Remember, the key to managing central line complications is knowledge, vigilance, and adherence to guidelines. Thank you for joining us today, and stay informed.